get started. So thank you all very much for joining us this afternoon for our accreditation webinar during Simulation and Healthcare Week. Hope everybody's having a good week. It started today, so hopefully it's all good. So again, welcome, and we're going to spend a few minutes this afternoon really talking about accreditation, and it's really the true standard for excellence in your program. We're going to be talking about becoming an accredited program and really the value that that brings to your program, why you should become accredited. I'll be joined by my colleagues, Jack Yeager. He's going to be our incoming chair next year for the Council of Accreditation. Kristen Gadgets is our Director of Accreditation. Don Shockton's a past chair and also our board liaison, and Kathy Deckers is one of our board members today. So we'll be presenting our presentation here around accreditation. For those who may or may not be aware, I'm Tom LeMaster, by the way. I'm the chair of Accreditation Council at the time. Accreditation, you can become accredited in core plus several other areas of teaching, assessment, research, system integrations, and most recently added on is fellowship. And what we're going to talk about today really focuses much around patient safety in our core accreditation and really how that helps. And we'll explain much more about that later on as we go. So once again, welcome, and we'll be allowing some time at the end to answer questions from the audience. Next slide, JJ. So first, we would really like to just talk about a value statement for accreditation. And accreditation by the Society of Simulation and Healthcare really demonstrates for your organization that you're an organization that is performing at a level of excellence. You meet some very significant standards of both internationally and nationally that are simulation-based, can talk, healthcare education. We talk about performance improvement and integrity. So once you become accredited, you're really demonstrating that you're at a high level of excellence in your simulation activities. And really, these activities, or this accreditation process, we've been tried and tested over the years. We've actually accredited many programs since the beginning of 2010. And folks have attained this accreditation, and it's really demonstrating their resilience, evidence-based infrastructure that provides their benchmarks for simulation programs. And the program performance really ensures learners high access to high quality simulation training, resources, and expertise. So it's really demonstrating that you're doing a great job. You have high level, high quality simulations that are happening within your center. And again, these standards have been around since 2010, and we've had many programs that are now being reaccredited, and some reaccredited a couple times at this point. So there's a really significant value in once you become accredited, and we're actually going to break that down just for a little bit for you this afternoon. And I'm going to turn it over to Dawn, who will talk about that more.
We've created a little graphic for you to think about when you're becoming accredited so that you have some return on value and return on investment to go to your chief operating officer, your C-suite, or your administrative dean suite in the programs that you're working in. We've broken it into 4 areas, which we felt were the most critical portions of creating a safe patient environment. The first is outcomes. So when you're looking at patient safety, you certainly want to make sure that your outcomes are clearly measurable and pointing towards the positive of increasing patient satisfaction and patient safety. And in our standards, they are represented in the core standards, the teaching and education standards, systems integration standards, and research standards. Each of those standards clearly outline areas where you can create specific points to your outcomes. The learner and teammate retention, we believe, is a mission critical area for most organizations, because if you can retain your team and retain your learners, you tend to have better outcomes and better program continuity. And these can be measured. You can point to areas in the standards in core, teaching and education, systems integration, assessment, and fellowship. Sustainability is the program's ability to maintain and sustain over the course of time. And we have standards in core, assessment, research, and teaching and education that will help you discuss your sustainability. And supporting your system's mission and vision goes throughout all 5 of our areas where we do our accreditations. Each of these areas have a question in the standards asking about your specific mission and vision and how it supports your area of working through the areas that your hospital or your academic center or your outreach program is improving patient safety in the community. I'm going to start with outcomes, and then my colleagues will go forward from there. In outcomes, we're looking at quality improvements accomplished via simulation to improve patient care. We bring our learners in and we work with them very carefully to do quality improvement processes. We improve the level of practice for all healthcare professionals. We have improved patient satisfaction via well-trained healthcare staff. Almost all hospital-based systems are worried about their patient satisfaction. We have improved patient safety via our simulation standards specifically, and we have increased visibility via publications developed following the rigorous data collected through simulation. So as you're creating your program and you're looking at the various standards, you can point to these areas which will help you sell your program on the outcomes that can be produced. And JJ is going to give us a discussion on learner and teammate retention.
Yeah, it's essential to have learners and staff members, teammates who are invested in your program, and accreditation can certainly have an impact on how well you're retaining your staff and retaining learners, or just bringing in new learners into your programs. And so we felt that accreditation makes a significant impact on that in many ways. For one, making sure that your staff, your learners have the right tools available to them. So accreditation ensures that policies and procedures are in place to make sure that all of the components that are supposed to be there, whether it relates to safety or psychological safety or the right equipment is appropriate there. And that has an impact on retention. It ensures staffing models are appropriate for the size of your program. Accreditation definitely looks at your human resources to make sure that there's enough people in places. It obviously looks at financial sustainability and stability. So in order to make sure that your staff are being paid appropriately, having the right sustainable model in place is important for that. Accreditation ensures that orientation processes are complete and checklists are in place so that when you have a new teammate that arrives or a learner, that they're being oriented to the simulation program appropriately. It promotes advancement and continuing education for your staff members. Everybody who works for you wants to know that they're being invested in and that they're looking at their future. And so if they are more engaged there, they're going to be retained more often than not. Accreditation promotes 360-degree evaluation of your staff. Your staff want to know that they're part of the improvement process and that they're helping others. Employees and learners want to know that they're being listened to. And so accreditation really focuses on the feedback process and the evaluation process that is present. And this is certainly things that SSH has focused on over the last 12 years to make sure that those processes are in place, that evaluation is done well. And finally, learners and staff members, teammates, they want to know that they're helping others and invested in quality and patient safety issues and even saving lives potentially. And so a standardized accredited program is going to show much more where that those sort of things are happening, that you're invested in the system, the overall larger organization that you work with, for example, like a hospital. And so those things are important, and people want to know that they're making a difference. And I think accreditation helps kind of show that. I think Kathy's next.
Tom's doing mission vision.
Yep.
Oh,
No,
good time.
yep. So one of the things that's real important and early on in the application process is the mission and vision of your program. The accreditation process really establishes or helps you establish that foundation statement for the purpose of your simulation activities. What are you here for? What is the reason of your work? What is the reason the simulation program is in existence? Who do you serve? Is really important in this statement, and how you're going to do that. So the process of accreditation really helps you establish that foundation. It also pushes you toward the objectives for your simulation training. Again, it goes back to why are you here? And then furthermore, a vision of where are you headed? What is your goal? What is your purpose? What's the, if there is such a thing as an end game, it's your vision of your simulation program. Without those mission and vision, you really, where you headed and how you're going to get there. And you really need the mission and vision to guide you that. And the accreditation process really, really helps you to establish that. It guides you toward those goals of excellence in simulation training. As my colleagues have mentioned, all the different things that are required for the accreditation process really build upon excellence in simulation training. So again, this whole mission and vision statement is guiding you in that direction to be the best in the region or to the best in the world in some cases maybe. As far as the what are you doing and what is the reason of having a simulation center? It does create your long-term impact goals for simulation education. So again, what is the final, and then really it's a journey, it's not a final destination, if you will, with your vision in most cases. But what are your long-term goals? The next step behind this mission and vision is developing a strong strategic plan. And what are the mileposts? What's going to be implemented, and what are your goals that you're trying to accomplish? Again, this first steps in the accreditation process. You'll notice that we ask you that question right up front. The mission and vision is linked in the application process to every single standard. We ask you to identify how your mission and vision supports teaching and research and assessment and system integration. So it is a critical piece, and much of that is really driven around excellence and focused toward meeting the goals that you set forth. And I think, Kathy, you have sustainability?
I do. So sustainability. We believe that accreditation plays a large role in sustaining your ability to continue as a simulation program. First and foremost, in a day and age where you need to distinguish yourself from the competition, many of our accredited sites tell us that that's the first reason why they've applied. They're trying to build brand recognition and gain a competitive advantage in their marketplace. Accreditation of your program offers a holistic approach for you to be able to differentiate your brand. As you go through the process of looking at the accreditation standards and getting your application ready, our programs tell us that the process helps them establish a culture because the standards are set to focus on maintaining a culture of improving performance and outcomes related to simulation activities. It creates a culture of data collection and analysis as the foundations for simulation practice and process. And those data collection points and analysis are then used for performance improvement, which is often the last place that a simulation program looks to collecting that data and actually making data-driven decisions. When we're talking about longevity and maintaining your outcomes, I think once you've gone through the accreditation process the first time, you see the value in how it really has allowed you to clearly define your return on value or your return on investment for simulation-based education. Programs often tell us, we often ask during the interviews, what did you learn on your journey? And they tell us how much they've learned about how their simulation endeavors impact their outcomes, how that whole process of putting the application together really allowed them to embark on a journey that adds value, and rather than just a process of certification that ends when they achieve the certification. And I think the fact that we have multiple programs that have been accredited 2 and 3 times see that value in continually maintaining that process as a journey for both the program itself and for that return on investment for whoever is looking at their outcomes to justify whether they should still support the simulation center. And lastly, accreditation helps you through the process that Tom was describing, through creating a vision, creating a strategic plan to allow you to really focus your simulation resources towards strategic outcomes. Not everything is fixed by doing simulation-based education. In fact, sometimes that isn't the answer. And if you really understand your program, because you've gone through accreditation and you really understand what your strategic goals are and how they are linked to the larger program and the larger system, it allows you to have conversations with your leadership to make deliberate choices and create links to that sustainability by embedding and articulating the value added. So most of our accredited sites will tell you they started with a goal to just be the same or distinguish themselves in the marketplace, but they end with a really solid understanding of what they do in simulation and how it matters to both the learners, to the faculty or facilitators that are working with them, or to the bigger system that they're with, either that is in an academic setting or in a healthcare setting. It really links that whole process and allows them to have more deliberate conversations about what they do and how it matters.
Thank you, Kathy. That's our presentation slides that we have prepared. We do want to provide opportunity for questions, and I do believe we have a couple already in the chat box. The first question I see, and help me articulate if I don't do this correctly, the question is around developing a strategy or starting points to convey to the stakeholder to go for accreditation. So it sounds like if you're already an established program or a simulation center, the good news is they've embraced the fact that they've allowed you to develop a simulation center, that you're there. So hopefully you have champions already in place. So now the question is, how do you get them to consider applying for accreditation? And I think much of the things we've spoken of today would help you in creating really just again, the value statement of why should we become accredited. And we would be able to speak to the being able to distinguish yourself amongst other programs or similar programs, or join an elite group of folks who are already accredited. There are lots of benefits, as we discussed, that and maybe it would be toward the fact that you can recruit more students, recruit more individuals to your program, the ability to demonstrate in the marketplace the excellence that you are providing as far as simulation education. I will ask my colleagues if anything to add around that.
I think you stated it best in it sitting down and actually articulating your mission and your vision, which then can be converted into actionable goals and strategic outcomes. I think getting your leadership and stakeholders in a room where you can jointly craft that statement and understand what you're wanting from accreditation really begins the process. And once they're part of that process, they understand more and more through the accreditation process of filling out the document that you have to submit.
I hope that answers the question for you. The next question, I'll ask my colleagues if they would like to take this one, because it is a variable answer. It's how soon should you apply? Statement is, we started courses with students on August 1st, team of 2, and not started the process because we're overwhelmed with the start of class and with being a startup. Anybody want that one? Or I'm happy to go for it. So I think the process, JJ, did you want to speak to that? Or
I mean, I can, yeah. So
I can.
we do have 2 processes. We have a full accreditation, and then you can also go for provisional accreditation. Provisional accreditation allows for a program that does not have a lot of data yet. And so if you're a new startup program, that's what we would probably encourage you to go for, because it starts to help you get everything in place before you need some of the data that's relevant for full accreditation. I will say all of us here that are part of this, and all of our reviewers have been part of accredited programs before. And so that's a significant point, that all of us have sat in the seat that you are right now, where you're trying to decide whether or not to go for accreditation. So I think that's essential, that we do have that empathy there, but also we've also been through the process of learning that, oh, I don't have this policy in place that I needed to have, or I don't have this data or that. And accreditation helps you kind of grow up a little bit as a program. And that's certainly was the case with my program. And I think the sooner you can start on starting to collect those things that you need more information about or need more data on, the better. And I think provisional accreditation is a good way to start with that.
I'd also like to add, it's not a one and done. I really believe that the process of accreditation is this growth and development of your program and your center and your ability to articulate what you do. And I think the sooner that you start that and get some feedback, that's great. You put down your policies, your procedures, some ideas of how you think you want to do it. And then a team comes and reviews your documents and has a conversation with you and is able to give you even more information, how to grow and get yourself ready for full accreditation, while saying, hey, you have the fundamental elements of core and teaching in place, and go forth and prosper. And I think we do have sites that go for provisional accreditation even before the doors open with learners. So know that it's a preference and it's a choice. And a lot of it has to do with how much time you have. So I guess what I want to say is, don't think of it as I'm going to sit down and spend 6 hours putting a document together and I'm done. Think of it as, this is a process that I'm going through to fully articulate what it is that we do. And it may take longer than that 6-hour document that you're putting together.
I think I also wanted to add that when we teach these courses as a webinar, or when we're teaching, our colleagues at the bigger meetings, many people come having not done any start of accreditation. So laying it out as a blueprint for how you would start your program helps you become in the right direction at all times. So you're always pointing towards accreditation. And then when you've got enough data, if you start with your policy and procedures and you say, okay, we've got that, and now we're going to work on our mission and vision and our strategic goals. And as you're moving forward, you're going to see that you've got your documents that you've been aligning yourself with, as Kathy said all along. And then the process of accreditation isn't as onerous as it seems when you're looking at the document itself.
Thank you, Dawn. Hope that's a long answer to your question. Thank you. Hope that helps. Our next question is, we've reviewed the standards and companion documents. That sometimes is half the battle right there. That's the great thing. Is there a template we need to use when completing the application? The answer is yes. When you go through the application, you'll be directed to a site where you will upload all of your application materials. However, I will say, and for me personally, there is on the website is a self-study tool. I would encourage you to answer and respond and document your responses in the self-study tool and collect all your information before you try to just start typing it into the program. It's called WiseHive. That point, you can actually just do a cut and paste, and it will be very easy as you go through the process of completing the application process. What I'm saying really is I would create all your documentation first and then do a cut and paste into the application system. Anybody have any thoughts on that one? Kristen is actually the expert at WiseHive. So
JJ, if you, I can just share a sample really quickly to kind of connect the dots there. JJ, if you relinquish your, thank you. I'm going to share my desktop really quickly. Share screen. So when you go to our SSH website, if you just go to SSH Accreditation, excuse me, you'll see down below how to apply. So that's going to get you to a link that Tom was referring to, WiseHive. It skipped me through because I already have a username and password. But typically it'll ask you to create a username and password, and that, we just recommend that for every program that applies, that username and password is going to be specific to that program. So it might be an email address, but every program, if you have 15 people developing the application, you're going to submit it through that one username. And so just be prepared to share it, I guess. But anyways, once you get into WiseHive, you'll fill in your username and how to apply, and then it'll prompt you through what is required for the application submission. So you can see I just clicked add another. And this is for the full application. Provisional is similar, but it's going to obviously follow the provisional standards. And so at this point, this is what Tom was referring to. We have our basic information, which is just kind of demographic information, the nuances of submission. We ask for review dates, et cetera. So this portion of the application should really only take about 30 minutes, but this is the link that you'll get for supplying the actual documentation that our reviewers are going to review. And you can see, as Tom was alluding to, it's simply going to be our standards. And we're going to give you the option to provide a text response for some standards, and then other standards that might require supporting documents. We're going to give you the opportunity to add files for that. An example might be an organizational structure. You might upload a PDF for that. So as you're going through our standards, begin to collect the data in that way. Go through 4.1.A.I and create a document that has a response to that, so on and so forth, so that when you're ready to submit, you can either copy and paste, or you'll have the appropriate documents to upload. So hopefully that helps to clarify. I will stop sharing, JJ, and you can share your screen again if you want.
Okay, thank you, Kristen.
Sure.
Our next question, I'm not sure I completely understand, but help me out, Barbara. I'm starting by looking at the HSS OBP, performing a gap analysis. Do we recommend that path or going directly to the accreditation standards? I would say we probably would go right to our accreditation standards, because we're going to ask you about doing gap analysis in those standards and some of the different formats. We're going to ask how you do that. Do you do those gap analysis? So it's really going to ask you about that process as far as simulation goes, and developing, in the accreditation process. Any thoughts on how to answer that differently, guys? Dawn?
Well, the HSS OBP, I'm guessing they're talking about the healthcare simulation standards of best practice that Anaxel publishes. And they do request a gap analysis, but when you're following when you're following the standards of best practice, you are able to answer many of the questions that are part of the accreditation process as well. So my first gut reaction would be to look at the accreditation standards and align what you're looking for with your gap analysis, so that you would be poised to be able to answer the questions that Kristen just showed you. You're welcome.
I would also add on to that, and somebody had mentioned this previously about reviewing the companion document. Everything that you need to know is really in the companion documents for each sets of standards. And so comparing or doing a gap analysis and looking at what's said in the companions, I think is a good place to start for you as well.
Thank you. Are there other questions? I think I've captured them all at this point. Does anyone have any other questions they would like answered around accreditation? For the
You can also just ask them directly too. You don't have to type them in.
Yeah, you don't have to type. Any of my colleagues have anything to add at this point?
I would say that if you look at your core standards and you download them and put them on your desktop and just start thinking about what the different sections are and take it piece at a time, it is not as overwhelming as it looks like when you're looking at the whole document. And if you download the companion document at the same time, you'll be reviewing things that look exactly like, other people have done. And there's a lot of us available, and there are, you can reach out to Kristen, and you can reach out to Betsy in SSH to get more additional information. I see that, looking at lessons learned from additional current accredited institutions. If you reach out to Betsy and to Kristen, they can probably help you match with people who have programs that are aligned with what your program looks like. They can help you with the documentation. The documentation only looks onerous. Once you get into it, it's pretty logical and thoughtful. It's probably what you would consider your SOPs, or standard operating procedures, that you follow every day, because everybody is organized and you can't just sort of start simulating. You have to have a system that you work with. So
I would just like to also share that the accreditation process has been around a while now. We've been doing this since at least 2010. So that means 12, 13 years now of rigorous review, standardization of our standards. It's been vetted, it's been delineated, been poked and prodded in all the ways you would want. We do have an independent board of review that reviews all of our accreditation materials. I think that's an important point to make. All of our site visits for the first time around are in person, and we feel that that's a strong way to determine whether or not a program is meeting all of their standards. And we feel like the way that we do things is a broad spectrum of a review of your sustainability, of your foundations, and we think that's important. I would also like to point out a couple of other ways that you can get more information about accreditation. There are Moodle courses available through the SSH website that Kristen maybe could speak of a little bit more plainly. And then at IMSH, there are several accreditation courses that we're going to be providing. We always provide what's called a top 10 for accreditation that is an overview of accreditation, but this year we are actually expanding on that to allow for a very hard review of just core standards, of the teaching standards, of research, assessment, fellowship. Each one of those will have their own courses at IMSH this year. So I would encourage all of you to go to those.
Thank you, JJ. We have actually a couple more questions popped up, and I think one's been answered. Is there availability of community to share lessons learned? And yes, Dawn has addressed that. Another one for sim activities listing Excel. Do you need that exact format, or is there another format with same content sufficient? And that one's is an example, and if you use it, great. But if you have another format that it lists all your activities and your hours, etc., we see that in a couple different formats, and whatever works for you as you report is generally just fine, as long as it has the same content that we're looking for. So any other questions that you might have, either type them or you can actually just tell us and ask us. So we do thank you for your time this afternoon and joining us. Look forward to seeing you all at IMSH soon. Very soon. Seems like so. All right. There's no other questions. I guess we could give your time back today. Thank you all very much for your time and joining us this afternoon. And please reach out to us through the website, through Kristen, Betsy, if there's any other questions that come up after we have left you.
Tom, I just popped my email into the chat too.
Okay.
Feel free to reach out with questions. Thank you everyone for attending, and thank you to our amazing presenters.